After years of brutal conflict, Sierra Leone is now witnessing a steady improvement in its security and political stability. However, many challenges remain, not least the rate of under 5 mortality, which is the highest in the world. Geert Cappelaere, head of UNICEF Sierra Leone, was in the UK recently. I began by asking him to outline the situation facing children in the country.
Well, Sierra Leone is still today the least developed country in the world. It is also the country where the mortality figures amongst children and mothers are highest for the entire globe. So the situation can be described as very dire still. As you know, Sierra Leone went through a bloody war ending in 2002. We are 6-7 years after the war, and still it is still obvious that children bear the scars of the war, but also the scars of the underdevelopment that was there prior to the war. So the situation of children is still very dire, and that is expressed in the health situation of children, with close to 1 out of 3 children dying before age 5. But also very obvious when we talk about education. While big advances have been made, still 30% of the kids are out of school. Many children, 70% of children, are able to start primary school, but much less are able to finish. Protection remains a big challenge, not any longer expressed as children being used by armed forces, which was true during the war, but there is a lot of exploitation still. Sexual exploitation, definitely the most dominant form of exploitation in the country. Most of the children have to work in order to help contributing to the family income. Children are orphaned. In Sierra Leone, 1 out of 5 children is not living with their biological parents. 1 out of 10 children is orphaned. Of course, the war is one of the reasons for that, but also the very low life expectancy. The life expectancy is around 37 for women, 39 for men, meaning children do lose their parents at a very young age. So that is, in a nutshell, how I would describe the situation of kids.
Why is life expectancy so low in Sierra Leone?
Well, the low life expectancy is probably to a big extent explained by the extreme high under 5 mortality. The figures for 2005 were mortality of 267 kids dying before age 5 out of 1,000 births. The reason for this huge mortality figure are multifold, of course. Malaria is the biggest killer. The lack of access to drinking water and the poor sanitation throughout the country is contributing to a lot of waterborne diseases. So diarrhea, second biggest killer. Pneumonia, the third biggest killer. And important to emphasize is that malnutrition is a critical underlying force of all mortality. Malnutrition is a big challenge because the problem is not the lack of food. There is food available, but it is the diversification of the food intake that is critical. Another issue related to nutrition is the low levels of exclusive and early breastfeeding. So a big program of UNICEF is focusing on behavior change, communication, focusing very much on changing practices related to breastfeeding, but also, for example, the reality of the teenage pregnancies, the child marriages, behavior change communication, strongly emphasizing that it is important for a girl to go to school. So very much working on traditions, challenging traditions, so that whatever they are, they should be supporting a child, should be supportive to respecting the child and respecting the rights of the child.
What else is UNICEF doing on the ground in terms of child survival?
Okay, well, we have in our child survival program a number of strategies. So you will find in our child survival program 1, health-specific interventions, which includes immunization, making insecticide-treated bed nets available. But we do not focus only on health. As mentioned before, nutrition is a second important pillar of our program. So we try to help providing diversified food, but again also very important behavior change helping people to see the importance of a diverse diet, to not only just stick to rice and palm oil, as it were, but to also take the benefit of vegetables. Water and sanitation is a critical element, guaranteeing that people have access to drinking water, that there are proper sanitation facilities available in each community is a critical element. And one example of a strategy is our community and school-led total sanitation, where we empower the communities to first, as an initial step, to realize what open defecation in the communities may imply in terms of health hazards, but then also empower the communities to think about solutions to that and help them building their own latrines, but in a way that is very sustainable for the community, also by engaging schools in that.
How has support from UNICEF UK helped with your work?
Well, let me thank very much the UK National Committee for UNICEF, because since 2006 we have received considerable support, particularly for our child survival program. We did receive a support, I would say, in three critical areas. One is around nutrition, and that has been very, very important in helping us setting up outreach programs for addressing malnutrition. Second contribution from the UK NatCom did focus on diarrhea and the prevention of diarrhea through sanitation programs, so the community-led total sanitation I was explaining before. The third contribution we did receive was related to HIV/AIDS.
What are your plans for the future in Sierra Leone?
Well, we have very ambitious plans as UNICEF for Sierra Leone. Sierra Leone is a country, despite all the dire statistics, it is a country I've been working now in for 4.5 years. And it's a country of hope, a country where I see a lot of potential. But in order for that hope, that potential to be achieved fully, it will require a long-term commitment from the government, but also a long-term investment from development partners. One of the immediate next steps, and a massive next step for UNICEF, is to support the government at their request to, over the next 2 to 3 years, to procure for the government all essential drugs and medical supplies. And in that same period, help the government setting up its own proper quality procurement system and a proper supply chain management system. And this is the immediate future. It is a huge operation for UNICEF, but it is an operation we have to engage in if we are willing to make a big difference in the area of child survival.
This is Andy Brown reporting for UNICEF UK.